I mean, in your speech, you described the figures as being massaged, fanciful, and unrealistic. In doing so, are you suggesting the Chief Financial Secretary or civil servants or both are complicit?
No, what I'm saying is that this is a political decision by the government of the day, and I can demonstrate that as I did this afternoon. When you've got a 2.5 budget surplus, a prospective budget surplus, but you've underrepresented figures in the health budget, for example, that really are not realistic. So, for example, it's built on the hopeless fiction that the Health Authority will spend £26 million less, that they've provided only £1,000 for teacher cover, when the government knows that for temporary cover for teachers usually costs about 1.5 to 2 million pounds a year. Well, any of those measures means sponsored patients, they're providing 10 million, when they haven't spent 10 million for years in the sponsored patient budget. Going back to 2018-19, they were still spending more money. So by the time you collect all those, it just doesn't take too much to realize that the underprojection that we warned about last year, because we warned about the Health Authority being underprojected last year, and indeed that came true because the Health Authority could not keep to its budget last year. Once they are not able to keep to certain key aspects of their budget, well then clearly the budget surplus goes. And when you then look at the measures that they announced today, so the tax lump sum, what we call the election handouts, costs 6.5 million. So that's blown the surplus already. The tax reduction, because we know that the Chief Minister said to us last year that the tax increase of 2% gave 17 million. Once you return 1%, you're returning a few million pounds to people. So that's blown the budget surplus as well.
Okay. Well, we've had some focus on the GHA. You say the cost projections for certain departments, for example, the GHA, are unrealistic. You've emphasised that point, yet there has been a drive towards greater efficiencies. Now, if the projection had been higher, would you not also be criticising that?
Well, there has been a drive for greater efficiency, but that's exactly my point. Because there's been a drive for greater efficiency, and because those controls have been introduced, because they were announced to have been introduced a long time ago, you can't make projections of big cuts going forward because they're unrealistic. So, for example, when you look at the GPMS prescription budget, you're looking at the sum being spent in the GPMS budget prescriptions normally is between 12 to 14 million a year. They're projecting 9 million, having already introduced those reductions and controls. So we think it's unrealistic. But it's really a sum of parts. Once you look at the list that we identified in the budget, and we were very careful analysing the budget, you realise that the 2.5 budget surplus is a hopeless fiction, especially against the backdrop of budget measures that are going to cost more than that already.
Okay, you've made your thoughts clear on the lump sum that's going to be going out to workers, calling it buying votes. Yeah, for many it will probably be very welcome. Would you rather the government had not announced this measure at all?
No, what we're saying is that, target the people on low incomes, but do it properly, because when you analyse this, it doesn't meet the union's expectations, because public sector workers haven't had a pay increase in 4 years, but it's not really targeting people on low incomes, because civil servants of getting salaries up to 100,000 are getting it. So imagine being a person in the private sector with a household income of £30,000, knowing that the government is introducing, at the time of the biggest cost of living crisis ever, where you are really suffering to make ends meet, that some of your hard-earned cash is going towards, for example, a household of 2 senior servants, civil servants, who have a joint collective household income of £190,000. Well, I think that's not targeting the low income, and that's what the government measure should have done.
Okay, so, following on from that, what would you have done to ease the burden of increased inflation, and would you have given the public sector a pay rise?
Well, I think that's the important thing. We criticised last year that when you increase tax and when it wasn't targeted to give to alleviate the measure on the low income. And today, that's exactly our point as well, that when you're looking at a measure like this, that if you really want to assist people in low incomes, you do so and you target people on low incomes. What this is an electioneering cash handout to be paid in September when we might be weeks away from a campaign or we might be in the campaign itself. It's very see-through and it's very shameless.
But would you have given the public sector a pay rise?
Well, look, the reality is we would have had to have had discussions with Unite. We're not cited on the complete picture because one of our big points is that there's hundreds of millions of pounds tucked away in a jungle of companies, as Sir Joe Bossano says. So we would have had to look at those at the money available and discuss it with the union. But one of the interesting things of the union report that was published by GBC just yesterday is that they were saying that a possible increase in salaries was going to cost 6 million. Now, we'd have to do the numbers on that, but the Chief Minister's measure is going to cost 6.5 million. So all of that would have to be taken in the round. And the Chief Minister just in the studio said what he would do if he's re-elected to government. What I would say is that if we win the next election, I will sit down with the Minister of Finance, who will be Roy Clinton, and the unions, and we will engage proactively and constructively towards discussing this issue.